think you can define stress in lots of different ways. You can split it up. What type of stress is it?
What is stress?
Is it acute stress? Is it chronic stress?
Listening to this is kind of stressful. Talking about it is stressful.
So is it heat stress, dietary stress?
How can I manage stress? Because I think we're all kidding ourselves if we think, oh, I'm not stressed.
Exercise or physical stress or load, psychological or emotional, sleep stress, insomnia, toxic stress from our environment.
Does that mean stress can affect our heart health?
Yeah, absolutely.
Welcome to Core Magna Heart and Soul, where we dive deep into the topics that matter most to your heart, your health, and well-being. Today, we'll be hearing from our medical advisor, Dr. Jodie-Ann Senior. Jodie-Ann is a cardiologist and heart failure specialist. In this episode, we'll be talking about stress and what it's actually doing to our bodies. Can stress really lead to heart disease? So, Jodie-Ann, today we're going to talk about stress. Everyone knows about stress, or everyone's experienced some level of stress, some more than others, I suppose, but it's a big topic. I must admit that doing a bit of reading and researching, preparing for this topic, did also stress me out a little bit, because I then learned that, unbeknownst to me, I've actually been putting my body through this really negative experience without realizing that it can actually have such a direct impact on my health. But I suppose first let's get, the obvious questions out. What is stress?
Yeah, good question. I think you can define stress in lots of different ways, and you can split it up into what type of stress is it. So, for example, is it acute stress? Is it chronic stress? What is the type of stress? So is it heat stress, dietary stress, exercise or physical stress or load, psychological or emotional, sleep stress, insomnia, toxic stress from our environment, say, or a medicine or an actual toxin or metals, things like that. So there's lots of different aspects to what a stress might be. But I think it's useful to think about stress in terms of perhaps like tension in a band.
Ah, okay.
Yeah. And this applies, I think, to our psychological, emotional stress as well as, say, an actual physical stress in our bodies. So our biomechanics don't work without some level of stress.
Okay.
Our bones need some level of stress through them to produce more bone. Without that, if we were like levitating, we wouldn't have any pressure through our bones. Yes. And we wouldn't make bones, so we would get brittle bones that break. But we want optimal levels of stress, whatever that is, whether it's physical or emotional. Without some motivational stress, we wouldn't do anything. But you think of it like a bit of a band and wanting just the right amount of stress on that band to do the job. So if it's too loose and floppy, it doesn't have enough tension in it to work and function, but too much and it's going to snap. And sometimes I think our minds are a bit like that. We feel a bit the same way. We've either got nothing going on and we're a bit bored and lost, or we're kind of like this, ready to snap at the next person who asks us for something.
Highly strung.
Yes.
For instance,
Yeah.
the language gives us a very vivid idea of what stress is. Right, so what I'm hearing is stress is a necessary aspect. We need stress to function. And the question then is therefore, how do we ensure that there is the optimal amount of stress to help us keep going, but we're not suffering from too much stress, right? Now, you talked about acute and chronic stress. Could you expand a little bit about that?
Yeah, so acute stress would be something that just happens momentarily. It might be something that's very sudden. And, if we think about why even do we have these responses in our bodies and our brains, they're linked to our survival and our primitive brains. So if you think about caveman days, we were primed in such a way to increase our chance of survival as human beings and avoid becoming prey, whether it was to an animal or another caveman. And so we have this system that is priming us for fight, flight, or freezing, which was all part of a survival mechanism. Okay? And so in an acute stress, that's something that's immediately threatening us. And there's a certain response that we have to that physiologically versus a chronic stress, which is one that's actually there continually over a period of time. But I know you did a bit of research just to understand what we call the neuroendocrine pathways. So
Yes, I did.
I would love to hear what you learned.
Okay, so, and please correct me if I'm wrong. How I've understood this psychological aspect of stress, which is really what we want to focus on today, is that, like what you said, as an evolutionary response, our body, it starts with the brain, right? So it is definitely real. It's not something imaginary. So there's a part in our brain called the amygdala. Nothing to do with Star Wars. When we are placed in a situation of threat or danger, the amygdala in our brain interprets this situation. It interprets the scenario. So the amygdala is essentially a data interpretation center. It interprets the scenario as a state of threat and danger. So that's what we know as stress. Now the amygdala then sends this stress signal to another part of our brain called the hypothalamus. The hypothalamus is essentially this communication and command center, I would say. It communicates, sends these other signals to the different parts of our body. It receives this amygdala's notification that there's threat, there's danger, alarm bells. The hypothalamus then, through an amazingly sophisticated system of nerves and hormones wired through our body, sends this signal to the adrenal glands. It sits on top of our kidneys, and the adrenal glands, after getting this signal, it produces what we all know as the adrenaline and the cortisol hormones.
Yes,
Okay,
that's right.
I've got that right so far? Very good. Now what happens after that?
So just a little bit about that. This is what we call it's a neuroendocrine system, so neuro being nerve and brain. So brain, as you mentioned, and then the nerves. And then the endocrine is hormones, and that's where the stress hormones come into it. But they're controlled by the nerves and the brain. Now, this all happens at a very subconscious level, because if we had to kind of think about all of this, we'd be dead meat, literally.
We wouldn't have responded quick enough.
Exactly. So all this is happening in the background without our conscious level of awareness needing to be involved. So again, that primitive brain is sending that signal, which is then, effectively translating in a lot of different activations. And in the nerves also activate heart receptors and vascular receptors. So what your body is trying to do, whether it's an acute stress like tiger trying to get me for dinner, my pupils are going to dilate so I can see better. My heart rate's going to elevate so that I can prepare to fight or flee. Right, blood is going to pump into my skeletal muscles. As it's doing that, though, it's going to divert it away from the stomach and the gastric content. So I better not have just had a big meal, or I won't be digesting it. Right?
Okay.
So all that blood's going to move and divert into the muscles so it can carry me away or prepare me for a fight. My blood pressure is going to rise, but at the same time, there's other things going on. I don't really need to think in that acute situation about fighting off an infection, for example. So, there's little messengers going out that I don't really need to worry about that kind of stuff. But I might need to worry about clotting my blood. If a tiger swipes me, I need to stop bleeding. So my body's almost subconsciously getting prepared to maybe clot and heal if I'm going to be engaged in some form of injury.
Wow.
Yeah, so it's pretty complex what's going on, and that's at a physical level, and it's all from the instructions of that perceived threat. Right? And so you imagine that in an acute situation, and that's very helpful to try and
need that to survive.
Save our lives.
Yep.
But then there's the more chronic side. So again, as an evolutionary response, we develop this response. However, now when we're not really in a situation where we're worried that a tiger is actually going to devour us for dinner, we've got more common things happening day to day, like, sitting in traffic and, having to dodge a car or a pedestrian, or having our bosses yell at us, or something like that. The family,
or a difficult client,
or the family
just
stress, or, that sort of thing. So we're now in situations where there's lots of these signals coming in, and they're not the same stress as a tiger trying to eat us. However, our brains are wired such that we perceive those stresses in much the same way. And so now what's happening is we're getting a more regular delivery of signals that we're under this stress, and our body is trying to behave in sort of a similar way, but it's now trying to find a way to sustain those effects. And we're not meant to sustain those effects. We're meant to have them come quickly, be like a very, very big flash fire, and then wipe everything out, and then it's gone. And shake ourselves off and move on, right? Assuming we survived.
Yes.
Yeah. But now we've got these lower level stresses that we're sort of almost responding to in the same way. And this is where the cortisol comes in versus the adrenaline. So the adrenaline's that very acute response that has all those effects on the heart and the blood pressure, and then the cortisol coming in is a more chronic level of hormone elevation. Cortisol's not all bad. Cortisol's the reason we get up in the morning, because, it peaks in the morning so we can get up and do our thing. But then, by nighttime it should really have dropped significantly, allowing us to go to sleep.
Right.
Now, can you imagine if your adrenaline and your cortisol have spiked at the wrong time of the day and they don't settle down, you're suddenly in a more heightened state, and in that state you're trying to sleep.
Yeah. So that's not going to help.
No.
And I suppose that's what we what we mean when we talk about stress affecting our sleep patterns and then having negative adverse effects on our health. So does that mean stress can affect our heart health?
Yeah, absolutely. I think the first thing to note is when there is some form of stress going on, whatever the precipitant of that acute stress is, that then sometimes leads us to behaviour that isn't helpful for dealing with that stress. So, for example, a lot of us will comfort eat. It's a way of trying to self-soothe. Instead of perhaps doing that in a constructive way, we'll do it in a very negative way. We might drink alcohol, we might smoke or vape, we might put on the television and watch, binge watch Netflix until 3 a.m.
Or eat
as
sugary
a distraction.
Things. Sugary foods
Eat
is
lots
a very
of sugary
common,
foods.
like ice cream, cake. That's a very common response to being in stress.
Yeah.
Stress eat, right?
Yeah. And then this is providing other additional additive stresses. So, the bad dietary inputs are now providing a further stress to our system that's actually a real physiological stress to our systems, to our guts, to our nervous system, to our digestion, to then, the rise in cortisol is going to also affect our insulin sensitivity and cause insulin resistance, more elevated sugar levels, and this has a flow-on effect to our health as well. So that will affect our immune system. It makes us more prone to developing diabetes if it's on an ongoing basis. It will then affect, the cortisol will affect our white cells, and our cytokines are like little messenger chemicals in our body that go out and send other signals. Our immunity is then impaired. And we were talking about sleep. So, that disruption in hormones also then disrupts our hormones that would help us digest food or help us sleep, which is what we're supposed to do at night. But some of us, night shift workers or people under other different stresses aren't sleeping when they really should be asleep, and they're not getting that rest period, and so that's further having this like additional cascading effect that's then affecting us physically.
And all these things that you mentioned, they're actually all recognized risk factors for heart disease. So I think that's kind of like what some of us may call an indirect impact of stress to our heart. I'm really interested about the direct impact that stress can cause to our heart health. I mean, I've done a bit of reading and I got really worried thinking about this because, well, the first one doesn't come as a surprise. Stress has a direct impact on heart health because it increases our heart rate and our blood pressure.
Yes, and look, the heart rate, if it's extreme, it can cause rhythm disturbance. Those rhythms disturbances can have then an acute impact on your health. They don't have to, though. It can just be a chronic elevation in heart rate, and over time that can actually cause problems with the heart function. In really extreme cases, it can cause heart failure. The blood pressure is an interesting one. So even in terms of cardiovascular risk, the number one risk factor as we get older is hypertension or high blood pressure. Stress has a very direct effect, acute and chronically, on blood pressure. So if we've got chronically elevated blood pressures, this then causes more stiffening and scarring in the heart as a response to that. It can cause what we call hypertrophy or thickening. So, you stress your muscle, your bicep, that grows. We want that to grow potentially. But we don't want our heart muscle to thicken and grow like that because actually it's a maladaptation. It's not a positive thing in the heart.
Okay.
Unlike skeletal muscle.
Right.
And so those things can then lead to stiffness and inability to relax and fill properly, difficulty emptying or squeezing the blood, and that over time can cause heart failure. And this actually is increasingly being recognised in our ageing population as well. And then you can get very, very extreme forms of stress injuring the heart. So we mentioned clotting earlier.
Yes.
If the blood gets more sticky, that leads to an increased risk that you might clog off an artery. And if that just is a clot, that can cause an acute heart attack, which could be life-ending. Might not, but it could be. But there's another factor. The walls of our arteries should be smooth and soft and vascular and springy. Under stress, the messenger chemicals can rough up the surface. They can attract and make the cholesterol sticky and cause more plaque and shear wall stress, and those things can lead to an increased risk of heart attack as well, let alone the high blood pressure, which is a whole other thing.
Right.
Yeah. Well, so there's multiple mechanisms.
Well, that's with the blood pressure, that's a good one, I think, to expand a little bit, because I think it's worth exploring how stress increases blood pressure. Now, again, correct me if I'm wrong. Is this something to do with the narrowing or constriction of our blood vessels?
Yeah,
is that the vasoconstriction?
Yes, that's right.
I think is the
yeah. Okay. So you want to think of so we, whilst we like to talk about these as maybe like a pipe.
Yes.
They're actually not like a rigid pipe. They're like an elastic pipe. So the muscle that is making up the walls of those arteries can constrict or relax.
Our blood vessels.
Yes.
Right.
In the
and
blood
this runs through all our body from the heart. Yep.
Yeah. So, in the heart model we had before, that's the biggest blood vessel of the body, the aorta. Well, that does the same thing, but then right down to these tiny vessels here over the surface of the heart, they are where, because they're only 3, 4, 5 millimetres thick, they are much easier to block off.
Right.
So if they block off, they cause the heart attack.
Right. And then the other aspect of the plaque, I think that's also really important, because when you were talking about when we're under stress, that causes plaque buildup.
Can do, yes.
Yeah.
Can make the cholesterol more likely to stick and cause plaque, but also the blood itself can become a bit more sticky, because
Right.
again, it's trying to prepare us for injury.
And this is because the stress signal that the brain's sending to the rest of our body, it's sort of telling us to prepare for battle, to
Yes.
prepare for war.
Yeah.
But of course, we know in a chronic stress situation, there's a mismatch between the signal and reality. We're not actually going to go fight off a tiger. We're not actually going to get hit by something. It's just something that's always brewing and bubbling in the background. Nonetheless, the body is getting prepared as if it's anticipating a wound.
Yes.
And so even though you might not actually get cut, get injured, you're not actually bleeding, the body's sending this, you're sort of getting the signals in your body in an anticipatory manner. If it's chronic, it persists, and that has a direct impact on our heart health.
Yeah.
Right.
And there's always a bit of a flow and an ebb between the signals. So it's not all one way and all another way, but it's like a to and a fro.
But when it happens more often than it should.
Yeah, the balance is disrupted and you're getting more of these signals that are causing things that we don't want to happen.
Okay. Now, let's expand a little bit on the heart rhythm problems that you touched on a little bit. So chronic stress has a direct impact on our heart rhythm.
Yeah, I mean, there's lots of different things that can cause rhythm disturbance, especially atrial fibrillation. But when the heart is too fast or goes out of its natural rhythm, that can have further consequences for our health and our well-being. Depending on what happens and how fast it is, we might get lightheaded or heart palpitations or dizziness. We might black out. Different things can happen.
Right. Now, I found that chronic stress can contribute to electrolyte imbalance. Stress imbalances the electrolytes such as potassium, sodium, calcium, and magnesium, and we all know we need those in our bodies, but you have to have a balance, not too much, not too little. Now, these are important minerals that help regulate heart rhythms. These imbalances can occur due to factors like dehydration, increased adrenaline levels, and a poor diet or unhealthy eating habits. Now, stress directly and indirectly contributes to these things, and the electrolyte disturbances then directly impacts the heart's electrical system. That's the rhythm that helps it to. We've talked about the cadence with which it pumps, and that's what we know as arrhythmia.
Yeah, in our bodies, particularly in our hearts, there are cell membranes and channels that across those channels, those electrolytes move, and sometimes we want them more in the cell, and sometimes we want them more in the blood or in the vessel. And depending on that balance, those are set up to operate the electrical circuits in our hearts. So if we have too much potassium, that can actually be lethal. If we have too little potassium, that can also be lethal, mainly because it sets up a potential for arrhythmia. Magnesium is the same, but you need much more extreme levels to have a fatal event from that. But it is very important.
Does chronic stress also impact our heart health because it triggers imbalances between the sympathetic nervous system and parasympathetic nervous system?
Yeah, yes. I mean, indirectly, I think, because again, those sympathetic and parasympathetic systems are having almost opposing actions. And it's about that dance, about that balance. So if the chronic stress is leading to more sympathetic action and less parasympathetic action, you get higher heart rate sustained for longer, higher blood pressure sustained for longer. Those then start having their own chronic effects on the heart and the vasculature system as well, which will end up causing, flow-on effects to kidney, brain, etc.
And I think it's important to acknowledge that a lot of this is still evolving. The science of this is evolving. I think from many, many years ago, when we never even used to acknowledge stress as having a physiological effect on our health or more directly on our heart health, we've now moved to a stage where there is so much research out there where stress is identified as an independent risk factor for heart disease. And it's also recognized, I think the WHO is now saying as well, that it is emerging as one of the biggest health concerns that leads to so many other health issues.
Yeah, actually I remember just during my career, it was discovered that there was a very acute, direct, severe consequence of stress that caused a condition called Takotsubo cardiomyopathy. And I remember the first time I saw this. And the patient. So she was a lady who had lost one of her sons fairly recently, and something had triggered a memory and an emotional response to that grief, and she developed sudden onset chest pain, quite intense, and medically, for all intents and purposes, she looked like she was trying to have a heart attack. And when we ultrasounded her heart, and when we just had a look with ECG too, there was dramatic changes on the ECG that we felt was like a heart attack. So we sent her off to the cath lab, and during that time to have a look at the arteries, we discovered her arteries actually looked quite clear. There was no problem or blockage, but at the very end of looking at the arteries, we always pump some dye into the pump itself, into the ventricle. So that's the, after shooting those, we try and actually push the dye in to have a look at the pump function and the ventricle. And the ventricle should look like that. See, it's sort of not quite triangular, but you can see it's a compact little shape, and so that keeps the overall shape of the heart into that shape. What had happened in her case was this bit was blown out and looked like a bit of a balloon at the end of it, or
the name
aneurysm.
Takotsubo.
Yeah, so Takotsubo was coined obviously by somebody who was Japanese, and it meant to represent the shape of an octopus trap, an octopus pot.
Right.
So here was this aneurysm, what looked like a blowout at the end of the ventricle, which we all kind of thought this was not good. And I actually sent her to a colleague of mine to have surgery to remove the aneurysm so that her heart would be reshaped and work better. And before they did anything, when she was on the table ready for the operation, they used the ultrasound to have a quick look. And lo and behold, it had gone and it was back to normal.
Wow.
So fortunately she hadn't had any operation,
Yes.
but it had corrected itself, and this was within 3 or 4 days of her presentation. At this stage we hadn't heard of this condition, but it turns out with time that this is a major stress response to a massive surge of these catecholamines, the adrenaline and noradrenaline in the body, that's having an actual neurohormonal effect on the heart itself and causing this picture that looks like a heart attack but isn't the same as what we experience heart attack when you block your arteries. It's generally recoverable and manageable with medications. So she didn't need to have any surgery or any stents or anything like that. And I've got quite a few of these patients, and I have to say most of them tend to be women, but I do have one man who's had it. It's not unheard of in men, but it's much more common in women.
Right.
And it tends to be associated with extreme grief usually. Not always, but that tends to be
an extreme event.
Yes.
So that's fascinating to really understand how that enlargement of the left side of the heart is such a stark physical response, representation, or the effect of what we commonly would say, oh, it's an emotional thing. It's a very extreme emotional event. And, because I think I've seen this on TV, that, there's a very emotional event in the family, there's a big fight, or something happens, and then the elder member family all dramatically, clutches their chest, and collapses on the floor, and everyone says, oh no, they've got a heart attack. But it might not be a heart attack, it might be a Takotsubo event.
That's possible.
Yeah, but we commonly mistake it for a heart attack.
But the more common thing, especially if it's a man,
yes,
is the regular heart attack,
right? But
that most people have heard of.
Right, but if the dramatic scene was that of a woman, it may be Takotsubo.
It's possible.
So what is the difference between Takotsubo, sometimes known as the broken heart syndrome, versus a heart attack?
Yeah. So, well, as we just heard, the Takotsubo situation is an acute event, acute grief response often. There's this flood of neuroendocrine hormones that are coming in and disrupting the structure and function of the heart, but it's temporary. So in the way, it looks like a heart attack because they're getting chest pain, and we do a couple of tests like an ECG and blood enzymes, and they look abnormal, like it could be a heart attack. But when we take them to the cath lab and look at the arteries are actually not responsible for the event. Something else is going on. In the more common scenario of a heart attack, the ones that we mostly see and hear about or understand, it's a different mechanism. The little vessels over the front of the heart or underneath the heart, one of them's blocking off or clotting. This stops the blood flow to the muscle. If you stop it for long enough, so say 45 minutes plus, you start getting irreversible damage to the heart muscle, and some of the heart muscle dies. Now, if that's a big enough area, that can be a life-threatening event, but in a smaller event, you'll survive it. But at the time, you'll have experienced probably some chest pain. Some people describe it like an elephant sitting on their chest, like a real heaviness or a pressure. You might be sweaty, clammy, feeling unwell, nauseated. You may have pain that goes up into the jaw or the teeth or in the neck. It could be into the shoulders, down the arms, or through to the back. Sometimes it's even more into the stomach than across the chest. But that classic scene that you said where people clutch their hearts, if you asked someone where's the pain, they don't point to a specific spot and go, oh, it's right here, because it feels, it's like somewhere there.
Is a broader area.
Yes.
It's not so
It's not
pinpoint.
ill-defined, like it's not really well defined. It's not, oh yeah, I got it right here, and if you press it, it hurts. It's actually more of a less well-defined area, and it feels very constricting.
And that's a heart attack.
Yeah.
Okay.
Yeah. And time is critical in those ones, because those blocked arteries you need to open up so that you save that heart muscle and stop the full event from happening.
And just so we get this right, chronic stress can lead to both the Takotsubo event, but also heart attacks.
Yes, but it's more the acute stress event that will lead to the Takotsubo, because it's like a massive rush of hormones.
Okay.
The chronic stuff is more akin to doing the other one, but if you've got an acute stress on top, that could lead to an actual event, usually on the background of all these things happening in the background though.
Okay. So I have a question, Jodie-Ann, about chronic stress and inflammation and whether or not this has an impact on our heart.
Yeah, good question. So chronic stress does have an effect if we have chronically elevated levels of cortisol, for example, which is more associated with that chronic stress, cortisol has a number of effects. It can make us retain salt and water, which raises our blood pressure, which can put extra stress on our hearts. It can increase shear stress. It can increase the messages to the immune system, cytokines, which are like the chemical messengers that might lower our immunity to infection or other sort of insults, make us more vulnerable to disease, but also that chronic inflammation can cause the artery walls, particularly like in the heart, those little vessels, to become more sticky, and then that encourages plaque to build up and form in the walls, which then increases the risk that you get atherosclerosis, which leads to angina or a heart attack.
So let me see if I can summarize this, because it's really important that we get this right. So chronic stress, which is real, which we've discussed, it's the brain, hormonal, nervous, and traveling to the heart and all that, all those messages that the body sends. It can directly impact our heart by, number one, causing increased heart rate and blood pressure. Chronic stress also contributes to plaque buildup and artery damage. It promotes blood clotting, which in the event of an injury or a wound
is a good thing.
We don't want to bleed out and bleed to death. But there is a mismatch in a situation of chronic stress where your body is anticipating. It thinks that you're getting into a fight and you're probably going to get a wound, and so it in an anticipatory manner starts to thicken your blood, when in fact that scenario never eventuates, and it just becomes a really unhealthy state for our body. That of course leads to clotting that can cause cardiac events, and I think we also talked about how chronic stress can lead to heart rhythm issues directly. We also talked about this really interesting scenario called the Takotsubo syndrome, where a very extreme stressful event, emotional event, and we might think of this as an acute form of stress, can cause the left ventricle muscle of our heart to enlarge, and that's why we've called it that Takotsubo, because it resembles the shape of the octopus trap. And that's a little bit different from a heart attack, which is another thing altogether, that all of these, the earlier discussion, those things also can contribute or exacerbate those conditions. So listening to this is kind of stressful.
Talking about it is stressful.
Talking about it is stressful, but I like to think of this as the good part of the stress, because this stress, in talking about stress, prompts me, at least, and I hope some people listening, into action. How can I manage stress? Because I think we're all kidding ourselves if we think, oh, I'm not stressed. And in fact, I think I have an interesting story to share. Many years ago, when I was a student, I needed a bit of extra cash. And so I volunteered for a stress study in the medical faculty of my university. And it was also a bit of a fun thing for me and a couple of friends to do, because we're like, well, we're not really stressed, but let's just go do it anyway, because we're going to get this £10 Tesco voucher. So I went in completely confident that I'm not stressed. And it was a very easy study to participate in. It was this computer screen, and we were meant to click and respond to a series of words and pictures to see if we were more prone to stress than others. Right. So me and my friends, a couple of us, as law students, I don't know why we thought we weren't stressed. Now when I think about it, you're a law student. Of course you were stressed. But at that point, I was totally confident that I wasn't stressed. I'm just going because I wanted that £10 voucher. When the results came out, it turned out that I was the most stressed.
Oh, really?
As compared to my two other friends.
Yeah.
And so we were having a laugh. I didn't take it seriously, and I just thought, oh, do you know what? Whatever. It was probably just me clicking on too many words and images. I might have done it wrong or whatever. I was just so happy I got the £10 voucher anyway. But now that I've learned about stress a lot more, I'm thinking back to that experience I had, almost 20 years ago now, and how stress is so pervasive, right? Sometimes I almost think we don't know when we're stressed.
Yeah.
Even though it has all these physical responses in our body, because sometimes we're taught to have certain attitudes, be very positive, have an optimistic outlook to life, that we might sometimes tend to ignore some stress symptoms, which is probably what I was doing back in the day, telling myself that I'm not stressed when I actually was.
Well, Amber, I don't think that's all your fault, because as we discussed in the beginning, remember that this is often happening at a very subconscious level. It's a part of our autonomic nervous system, which is happening, that's the same system, the parasympathetic and sympathetic, is telling us to breathe, telling our heart to run and operate, telling our vessels to do whatever they need to do. If we had actually stopped and consciously think about any of that, we'd all die. Because every time our brains were distracted, we would stop. We would forget to breathe, right? So
perhaps
don't beat yourself up.
No. And it's good that I didn't. I'm still here. So clearly there has been some management along the way, even though I might not have consciously was mindful about it. But the important thing here, now that I've understood stress and its direct impact on our health, especially on our heart health a bit more, I think it's really important to look at some stress management techniques and how can we manage stress, chronic stress especially.
Yeah,
Jodie-Ann.
I think the first thing is good awareness, and that starts with self-awareness. So for me, that's being mindful of how I'm feeling at any given moment. I'll tell you a funny story. When I see my patients, often they get nervous when you go take their blood pressure, and that stress response is enough to put their blood pressures up. So as I'm taking their blood pressure physically, I used to notice that I'd hold my breath when I was taking their blood pressure and waiting for the reading to come up, knowing that they were going to be anxious about the result. And so it's with a level of awareness that I check myself every time I actually wrap that cuff around and set them up ready to take the blood pressure. I ask myself in that moment, am I breathing? Am I breathing? Am I not breathing? And if you're not, just pause. And then what you can do is a very simple exercise which will change that balance between the sympathetic and the parasympathetic nervous system. You take a breath in for 4 counts, hold the breath for 4 counts, and then breathe out for 8. So this is called a box breathing technique. There are variations on that, but the emphasis is on the slow out breath. As you do that, you're immediately changing your physiology. You're engaging that parasympathetic side, the rest and digest side, if you like, instead of that fight-flight part of you. And you're allowing your body to actually go into a more calm recovery mode. This will help lower the heart rate. And actually you can, if you test it yourself, you'll feel your heart rate drop as you do that long out breath.
Okay, so let's see. Breathe in for 4 counts. So
in for 4. Hold for 4. Now out for 8.
Is that right?
Yeah.
Oh, that's nice.
It is, isn't
Yeah,
it?
that was really nice.
And didn't you immediately feel a change in your physiology?
Yes. Do you know what? I felt my shoulders slumped a little bit.
Yeah.
I think I feel like I'm set back a little bit because 8 counts is quite long.
Yes.
So when I was counting 1, 2, 3, 4, 5, 6, 7, 8, I can't, if I'm doing it even now, I feel like I'm somehow
Sinking
telling
almost.
myself sinking to relax. Yeah.
Yeah.
That was really nice.
Yeah.
Mm-hmm.
So you can do it once, even just before you, say, address somebody, if you're really nervous and you're about to have a conversation you're a bit worried about, you can do it 4 or 5 times just to make sure that physiology gets a chance to really set in and relax. That's a nice, easy way to change your parasympathetic and sympathetic nervous balance very quickly. Now, say someone's very, very upset and they need to calm down. If you just tell someone in that very, very heightened state to just calm down, often they find that almost impossible.
Yeah.
There's too much adrenaline going on,
Yes.
and they are really ready to fight. Now, if you need someone to snap out of that, one of the only ways to do it is actually expend the adrenaline. So one of the tricks I heard from one of my colleagues who's more in the psychology field of things, she would get someone to just find a quiet corner by themselves and airbox. So properly airbox with all your might.
So airboxing, you're
Timed.
pretending to box
Yep.
in air.
Yes.
Oh, right.
And you've got to time yourself though. Here's the trick. You've got to do it for 3 minutes. Now 3 minutes does not sound like a lot, but believe me, if you're really getting into the punch,
Right.
3 minutes is a long time.
Oh, it sounds fun, Jodie-Ann.
It kind of is. But the point of that is you will expend the available adrenaline at the end of that 3 minutes. You will really not have it anymore, and it's not affecting your brain and wiring you ready for a fight anymore because you've kind of had the fight and now you
Right.
kind of got the release.
So you've kind of hacked the system a little
Yeah,
bit.
a little bit.
You've hacked the adrenaline burst that you
Yeah.
have because you're in a very heightened state of
Yes.
of anger or stress, and I actually get a little bit when you're really upset and someone tells you to calm down. That can sometimes
Red flag
make it
to a bull.
worse. And again, I've seen, and we see this portrayed quite in a very caricature style on TV. It's like, don't ask me to come, that
Yeah.
kind of. So, but that's a great idea. So we're hacking that burst of adrenaline by pretending like we're in a fight, only we're not actually harming anyone, and we're doing this in a safe way. We're mimicking that action
Yes.
for 3 minutes,
Yes.
so that immediate outburst is expended,
Yeah.
and then all right, we
And
tell
then
ourselves,
you can do your breathing.
right.
And then you can approach whatever you need to approach in a much calmer frame of mind. And here's the other thing. When you go and use that fight-flight system that we have built into us for survival, it's only about survival. It actually is a more primitive part of our brain, and we're not using the cortical part of our brain, the thinking part of our brain, which is why we are pretty stupid when we're in that sort of setting and then we're all worked up.
And we regret our actions.
And,
yeah.
Or we say things that are not very smart and we behave in even less smart ways because we haven't got the cortical part of our brain thinking. It's the primitive part of our brain thinking.
Which is only wired towards the most basic form, which is survival.
Yeah.
Right.
Yeah, it doesn't want you to do arithmetic or come up with logical arguments. It wants you to flee or fight.
Right.
That's it.
Right. Okay, so I have a question. Does it
Yeah.
have to be this air boxing in case some people feel a bit self-conscious? And I know you said
Well, that's the point of going
into a
somewhere
room.
private.
So let's say, I suppose if I'm thinking about how I'm going to do this in practice, my office has a glass wall, so I will go to the
bathroom. Yep.
And I just do that.
Yep.
And I won't feel self-conscious. No one's going to think what's up
going on with Amber.
She's just lost it a little bit.
Watch out, Eric, stay away.
That's right. Clear the path. Get that energy out of my system.
Yep.
And then do this wonderful box breathing where I breathe in for 4 counts, hold for 4 counts, and then release for 8 counts. Yeah. Oh, I love that. I love that. Now, what about instead of boxing, let's say running on the spot?
You could.
Yeah.
Again, you need to do it for 3 minutes, and you have to go hard, because the idea is you have to really wipe out that adrenaline. If you just kind of, play at it, you're not really going to exhaust that adrenaline response.
So that means, in other words, we have to take that stress emotion seriously. That's why it's 3 minutes as well.
Yeah, you want maximal effort.
Yeah. Address it properly, deal with it properly, and that's why we need that 3 minutes. And then mindfully do that breathing exercise to calm ourselves down.
I was listening to a really fantastic audio book. It's Josh Waitzkin, the chess champion, but he also goes on to like Tai Chi, push hands championships. And he was talking about his training, and the book is called The Art of Learning. And he talks about difficulties in competition where, your mind is distracted or something's happening. And he said that sometimes what would happen in really, really long chess matches is the opponent was actually getting inside his head and actually starting to mess with him and throw him off his game. And he said sometimes he would actually just have to leave and go do some sprints and then come back and sit down and have another go. And that worked for him. But it's the same principle of expending that pent-up adrenaline and then allowing you to get back to good relaxed state for optimal cortical function of your brain so that you've got good conscious thinking.
Right. So that would be addressing the adrenaline pent up. What about the cortisol
side of things?
Well,
the cortisol is more chronic, right?
Yes.
So, again, there are lots of different ways of dealing with that, but it's over a longer time frame.
So how will we deal with, what are some long-term measures that we can take to manage the chronic stress aspect? Because that seems to be everywhere we go, everywhere we look. Yeah. It's in our homes, it's in our schools, it's in at the workplace. It's even when some people go on holiday, it's like they're on the Amazing Race. And I know different people have a different approach to holidays. Some people doing a Euro trip in 3 weeks, and I don't know how you could possibly explore a continent in 3 weeks, but I imagine that can be, especially if you're traveling with family and young children, that can also be a stress factor.
Yeah, I hear people need a holiday from
the holiday. That's right. So chronic stress coming from stresses from our everyday life. That box breathing would
so you
help.
can do that anytime. And I think the thing to remember is even when you do go on holidays, everyone recognises that time out from something that's hard, such as a busy, hectic work schedule, giving you a break from that's good. However, if you take that stress with you, you remember that's starting here
from the amygdala.
Then you're still having those effects. So again, about that mindfulness, being able to use the breathing. Now, it doesn't have to be all the time, but just as often as you can manage to notice, and then just even start like doing a bit of a survey of your body, and am I holding tension anywhere? And then literally relaxing that as you do your breathing. So that's helpful. But again, you were talking about chronic stress and how to address that. I think there are lots of ways of doing that, but what I tend to say to my patients is if you have hours and hours where, in the day you have high stress levels, such as a really stressful job. Maybe you're an emergency worker and, you've got a very high intense job. Then you want to think, okay, well, if I've got this much time in my life each day that I have a lot of stress, then I need to at least make an effort for a certain portion of the day to unwind that stress. It may not be that you can devote an equivalent amount of time, but you should definitely take steps to do something that counteracts that stress. So, for example, and the same can be said if you sit all day. That sitting is not helping your cardiovascular health, so counteract that with a bit of exercise. Whilst we're on the exercise topic, just taking a walk can be a really good way to get your cardiovascular exercise in and de-stress. And, especially even just after dinner. So you've just had this big meal, physical stress, and then your body's got to really digest it. If you wait 20 or 30 minutes, but then go for a stroll, it doesn't have to be a power walk, that stroll is going to actually help you connect with yourself, how you're feeling, or partner if you go with partner, or dog, that's a great de-stress right there. And you're going to breathe more comfortably, hopefully leave some of the trash talk in your head behind, connect with what you're seeing and engage around you, and then do something that's actually going to calm you down and de-stress you. Go for a walk, get some fresh air, clear out the cobwebs, so to speak.
That's a really good idea. I mean, walking is one of my favorite things. Any time of the day, I'm up for a walk. As you said, it's not just the physical exercise, the cardiovascular exercise, moving your body, but being out in nature when you're walking. I don't know if there's any sense to this, but I find being out in nature when I'm walking de-stressing because I find that my senses are distracted. It's taking me away from the conversation in my head, the psychological stress. Is that real? Is that?
Yeah, no, it can be very real.
That's my understanding of it. But because when I walk, I'm looking, oh, look at that tree. Oh, the colors are changing. Oh, what's that bird? Oh, look at this flower. And so then momentarily, whether it's half an hour, 45 minutes, or an hour, if I'm lucky that day, that my mind is taken off, as we say, from the stress factors in my head.
And there's something that's interesting too about, I forget what it is, but the soft lines that you see in nature, say if you're looking at the trees, versus the harsh lines of a building as something man-made, it's quite different. Next time you're out walking, just stand and stare at a building and then shift your gaze to something that's actually natural, like a tree.
Oh,
and you actually just notice how you feel when you're looking at the two. I notice a very clear difference in my physiology when I'm actually looking and engaging with nature versus, say, something man-made like a building.
I might experiment over the weekend to see what I feel. Yeah. But that's an interesting point. And these are all steps that we can take for free. Yes. It doesn't cost us anything.
Correct. You can go hug someone.
Oh, that's right. That's nice.
You can go pat a dog or have a cat sit on your lap if you like cats and stroke a cat. Those things actually send signals to our brain that actually encourage the release of oxytocin.
It's another type of hormone.
Love hormone.
Right, and we feel loved and cared for when we get physical contact, when we are hugged.
Yes.
By people we want to hug and people who we want to hug us. All consensual and safe hugging. Yes.
Yeah. But and the same happens with animals and petting animals because. Studies have shown even that animals as support family members, if you like, actually reduce stress as well, especially for people who are on their own. Because, people who are married into older age, that's a level of protection, that socialisation, that care, that love is protective. You take some of that away, someone loses a partner, then you have a vulnerable person, increased risk of dying after the other partner has gone.
Right.
Yeah, so this is where maybe something like family and hugs and loved ones can contribute in terms of how they reduce the physiological stress on that person. But also, having a pet can do a similar sort of thing. So that's another good tip in terms of like how you can actually modify stress. There are other ways, of course. I think, we want to reduce further injury, toxic stress. So, if you drink alcohol, perhaps look at other things that you can do instead. If you're smoking, obviously it's a personal thing in terms of how you might or when you might address those things, and you may want professional help to do it. But those things are adding on top of that other stress.
Yeah.
Dietary stress, when we get overwhelmed and a bit frazzled, we'll tend to reach for comfort foods or whatever's easy.
Yes.
But in fact, that's the time when you really need to just give that moment's extra thought about what you're about to consume, because if you ate healthy food instead of food that's bad for you, then you actually have a mechanism to reduce the stress rather than pile on more.
I want to talk about situations where we are really struggling on our own.
Yeah.
Whether it's because, let's say, we don't have someone to give us daily hugs. And, I sort of now call that my daily dose of oxytocin, right? Some of us have that, some of us don't have that. Or, we're just, let's say, unable to talk to people at work, to reorganize workload, different things. Let's say you're really struggling on your own and you've tried, or you can't seem to work it out by yourself.
Yeah.
What can we do to manage chronic stress?
There are lots of things that you can do in that situation, and I think if you feel overwhelmed, then the first thing you need to do is actually reach out and tell somebody that you feel overwhelmed. Now, that could be a friend, even if you don't share what's overwhelming you. But, my advice, and I see a lot of patients who, are in this situation, they're so stressed by their situation that now they don't sleep, so that piles on more stress, and then it's a vicious circle. And I think it's very important then that you reach out to someone who's a professional for help. So that the starting point could be your GP. The starting point could be one of the helplines such as Beyond Blue. It could be a friend, but again, hopefully that friend is going to support you to get some professional help. Just talking to a professional might be all you need, but that professional could then work out whether or not you need ongoing therapy, whether you may need medication, maybe you just need some help with sleep so that you can have enough reserve to then start dealing with what's troubling you, because once you're really sleep deprived, everything's a mountain and everything's too hard.
Yeah.
So it can really help to just get what's the focus for the starting point, and then how do we gradually regain some reserve to deal with the issues.
I really appreciate the fact that you've brought up seeking professional help. Many people might feel embarrassed that they need professional help. Should people be embarrassed?
Not at all.
Or ashamed?
No.
To feel like I need professional help to cope with chronic stress?
Yeah, I would argue that it shows a lot of courage to actually stand up and say, I need some support, or I'm not managing at the moment and I would like some guidance. I think...
So you think it's the other way around?
I do think
you think it's
the other
actually
way.
a demonstration of self-awareness.
Yes.
Doing the right thing, being responsible and being mature to recognize when you need professional help than to be in denial, I suppose, or just being irrationally not wanting to do something.
But I think these days too, there is much more awareness and much more acceptance of of stress and how it affects us, and that it is okay to ask for help. The sessions that you have are going to all be confidential, so it's not like it's going to be shared if you don't want it to be shared. It'll be done privately. But I think these days, and you said it at the beginning, stress is everywhere. So I don't see hardly anyone in my practice that isn't undergoing some form of stress, whether it's in their family, whether it's in their jobs, it's some life circumstance, they've lost someone or they're losing someone. It's
and these are all very normal things in your life, so we shouldn't be... It's something that
everyone is experiencing to some degree or other. And then it comes back to what level of resilience do you have to actually manage it, not be in denial of it and try and burrow through it, because we know that that just gets you into more trouble ultimately.
Well, heart disease being one of them. I really want to talk about this a little bit more because I feel it's worth really stressing the point. If we are recognizing stress as a risk factor to your health, whether it's other health issues or, in our situation that we're discussing today, various types of heart disease, like cholesterol, right? Then if there are all these other ways to manage, let's say, a cholesterol, you go and do a blood test all the time. No one's ashamed of that. You then, depending on your situation, you might have to be on some forms of medication. No one's ashamed of that. We talk about it so much. I think someone once told me statins, the prevalence of statins in our community is almost as high as fluoride because so many people just, are on some form of statin because cholesterol is such an issue.
And we're actively modifying risk.
That's right. So if we place stress, if we now identify stress, we put it on the same balance sheet, right, as cholesterol, blood sugar levels, and all these other things. Why shouldn't you do the same for stress, which should appear on the same list on that same balance sheet?
Sometimes my whole sessions with my patients are about their stress because that's what they need to deal with then and there.
And if that means regularly seeing a professional, then that's just what it takes, just like regularly doing your blood tests and regularly taking your statins.
Yep, absolutely.
Wow, Jodie-Ann, I think you've taken us through a lot of information to help us understand the relationship, the very real relationship between stress, and particularly chronic stress, and its impact, its direct impact on our health, particularly heart health, and how it's a direct contributor to heart disease. But also, thank you so much for sharing your tips with us in terms of how we can manage stress. I really love the breathing techniques that we talked about. I love the idea of going for a walk and immersing yourself in nature, and the importance of seeking professional help. The right thing to do is to acknowledge when you're struggling a little bit on your own and that you need professional help, because I suppose we do need to look after ourselves first before we can look after others. And stress is just like your cholesterol, just like your high sugar levels, is just as important as these other risk factors.
Definitely.
It's been really insightful. Thank you so much, Jodie-Ann.
My pleasure, Amber. Thank you.